This is Health Unabashed, broadcasting live on Healthcare Now Radio. Health Unabashed is where healthcare meets innovation, insight, and impact. We engage top industry minds to explore the future of health and wellness, from visionary thinking to sustainable models, policy reform to frontline delivery, and ultimately the real-world impact on public health. I'm Greg Masters, co-host and executive producer, alongside my partner in conversation, the ever-curious digital health aficionado, author, editor, global thought leader, and industry steward, Gil Bash. Together, we bring you the people, ideas, and movements reshaping healthcare, not with hype, but with purpose and persistence. Now, with no further delay, Gil, the mic is yours.
Greg, thank you very, very much for the gracious introduction for me and for the program. It is very hard to believe that we are heading toward our 6th year or 7th year. I forget. It seems to go in a blink. But thank you for all of those episodes, months, and years that have made this an exceptional program and exceptionally welcoming to our guests. And we have a very special guest today. I want to speak a little bit about Dr. Jamie Wisser for a moment. I think this is the very first time we've had a high stakes plastic surgeon on the program. And the reason I say high stakes is trauma surgery is probably one of the most delicate, difficult types of surgery or plastic surgery we can imagine, where it's not just sustaining a person's well-being. It's, in some respects, it's sustaining their connection to their community, to their family, to their sense of self-confidence. And Dr. Wisser is involved in all of that. So, Jamie, I want to welcome you to the program. But before we get started, I want to tell people where we met. Fortunately, not in surgery.
Yes,
but,
for you.
But well, heaven forbid. I'm sure I would be fortunate to fall into your hands if heaven forbid that were the case. But we met at a very unusual place. Sure. Jamie and I have known each other for a few years now, and we met through HitLab. And HitLab, as many of you know, Stenko Kochnowski has been on the program a few times, but HitLab is a community of people involved in health information technologies, digital health, med tech, all different distinct areas. And Jamie often, although he presents frequently, often I find him outside in the Microsoft building or inside the Microsoft building, outside the big presentation rooms. He's sitting there very peacefully representing his entrepreneurial enterprise, which we're going to talk about during the program. And it's very unusual because he's sitting there very mellow, very calm, very open to chatting with people, talking about what he's doing, why he's really created a very important digital platform for the health community. And there's this very unassuming nature to Dr. Wisser, who, is a very high-powered physician. Actually, I might add, has been identified or acknowledged as one of New Jersey's top plastic surgeons. And he obviously has built a significant practice. I believe you're located in the Princeton area. Is that correct, Jamie?
That's correct. Yes, right outside of Princeton.
Yeah, right outside of Princeton. He has associates that are doing all sorts of different work. He's supervising them. I believe he's been a chief resident during his surgery training. He has a long established, renowned career as someone who's very dedicated to patient care. And one would expect when you become that senior and that successful, and you have associates and you have a little bit of spare time to do something else, that it might be travel to the Northern Lights or whatever the case may be. Not Dr. Wisser, not Jamie. He is doing something very different. He is innovating and deploying digital health. And so, Jamie, welcome to Health Unabashed. And it is always a pleasure seeing you at the HitLab programs. Most recently, we were there during Health Innovation Week. And we were just chatting, and I said, gee, it would be great to have you on the program, and thank you for joining us today. I just wanted to go back in time. Obviously, the business is operational. You've got all sorts of staff that are doing that, but I want to go back to the moment where you sort of said, I need to do something about a problem that health professionals are facing. And obviously your expertise is surgery and trauma surgery and plastic trauma surgery, a specialty of a specialty of a specialty, digital health. How did you decide to jump to the other side of the track?
Gil, first of all, thank you for that very honorable and gracious description. That was terrific. I think the biggest driver behind the jump was seeing the need to do something to get the clinical staff out and away from sitting behind computers when the time being spent with actual patient care was being impinged upon because of the demands of, what I call the legacy or, original digital health technological inventions, right? So under, the Bush administration, G.W. Bush, the mandate came, the funding of over $22 billion was provided for medical or health records to be converted to a digital format. And there was a race, right? It was sort of like racing across the country. Whoever can lay their stake in a particular territory, that was their territory to own. So today there are over 1,100 electronic medical or health records technologies. And many have created market penetration and predominance. But the bottom line is that they house the digital information, but unfortunately accessing that information is restrictive, right? It's restrictive to having to use that particular platform. And it's restrictive because so many different platforms are used in so many health providing environments. So, the ability for that information to be crossed and shared has literally been the black box, the abyss. And, if I'm a patient physician at NYU and they're coming to me for a total hip replacement revision, and they underwent a hip replacement operation as early as or as late as 2 years ago at Hospital for Special Surgery, even though both of those hospitals are on a particular EMR, the information exchange capability is non-existent, right? So the patient becomes the vector, the fax machine becomes the vector, phones remain the vector. And in 2026, that's unacceptable, right? So the problem that I wanted to address was, can we as insiders, and I think this is where, as opposed to insider trading in the financial institutions.
Right, we're not talking about that, obviously.
No, this is insider understanding and knowledge of how things need to work. So setting up the algorithm and then backfilling into the black boxes of, let's get the technology to make that happen. And that was I don't want to say the master plan, but that was the formatting, right? Compared to a military, circumstance. Here's an engagement, we'll call it a war. We need to have a victory. How are we going to backfill to get there? What are the steps? And so this was really, my internal war to solve this problem and be victorious. And relentless in what I do in life, but I try to maintain a calm demeanor over the process because one must learn and iterate and adjust and modify. And people are your best source of knowledge in addition to obviously literature and that sort of thing. So that's been the mindset. The mindset has been remain calm, remain steady, remain productive, but don't accept anything but success in resolving this issue.
I'm thinking of your experience, and just before the show kicked off, we were talking a little bit about this. So often, in terms of digital health technologies, the inventor is a coder, an engineer, not someone specifically from the user side, the customer side of the technology. They're from the technology side of the technology, and you saw a need as someone who's a health professional, and your experience, I mean, your decades of experience as a surgeon really place you in that, well, customer user role, and effectively. I wanted just to sort of get into your mind or go back in time. There was a time you're sitting, I don't know, in your office as you are right now, or at the breakfast table, and you sort of maybe almost like network, I can't take it anymore. And you decide like instead of throwing up your hands, you say, I'm going to create the change. I'm going to create the change that I need to make this work for my team, and operationalize that across other teams. What was the inflection point? Was there a catalyst for this, or you just get up one morning and say, "Oh, I've got a few extra hours each week. I'll create a company that allows me to, pull in information across platforms so that I can understand what this patient will ultimately need from us." What was the catalyst of that moment? Do you remember?
I do. So one of the things that was happening was the digitizing of the steps in day-to-day healthcare delivery was dictating our workflows based on the technological limitations. So what does that mean? That means that if I needed to order something, I had to go into a computer and order it. It meant that if a patient were in need of pain medication, and the nurse would normally go to the medication cart, and if some other patient had that exact medication but didn't need it at that moment, she could use it to meet the immediate need of the patient in need, and then replace it by simply notifying pharmacy with a phone call and getting a substitute brought up. The digitizing of that process made it so onerous and so restrictive and so formulaic that our ability to actually meet patient functional needs and treatment needs was becoming hampered and inhibited. And that's when I kind of just said, it can't be, right? We can't change the needs of human beings and medical providers to fit the formulaic technological algorithms that have been outlined for us. And so doctors are very good at identifying problems in the world and complaining about it, right? This is wrong. This needs to be fixed. Someone needs to do something. We need to get, more respected by health insurers and be paid properly. Doctors complain wonderfully, but it's only a select few that take the initiative to figure out how to fund and how to move forward in executing imagined solutions. So, I've had role models in my extended family that have done things like identify tropical sprue for the first time in the history of the world in the early 60s, which turned out to be, celiac disease and non-celiac disease. So the model was there, the template was there, and I finally had treated enough people in my career that a one-off, and that doesn't sound like it should be a belittling statement, but a one-off of taking care of somebody to the best of my ability and have them do well was great, and it satisfied the need. But after 20 years, because I'm now in my 30th year of practice, after 20 years, I said, the impact has to be greater. There has to be better, capability to spread the benefit of my time and efforts so that it can be something for all, like democratizing, in my opinion, the benefits that are forthcoming as I envisioned them. So I envisioned them, I found people to work with, to develop and execute in ways that I'm unfamiliar with. But I basically said, this is our end goal, guys. How are we going to get there? And putting the right people together, the team together, the financing together has been, it's been the climb. It's been the challenge, but there's never been a doubt, and there's never been a giving up, right? This is my 11th year of doing this. And could I have not done it and retired early? Sure. But, I just wanted to make an impact to try to, what I call, rewrite the healthcare ship to get it back on track to the best of my ability, knowing that technology was the answer, because technology is not going anywhere. And if anything, it's only going to become more and more intrusive and invasive in the day-to-day activities of healthcare provision. So that was my thought.
I'm going to jump in and give a twist to what you just said,
Sure.
and get your reaction to it.
Just tuning in, you're right on time for Health Unabashed on Healthcare Now Radio. We're live. Stay tuned. Plenty of thought-provoking insights yet to share.
I don't know if technology was the answer. Technology became the platform for the answer. And I think the answer was the human experience that you represented, that you championed, was universal. And you were saying, it's frustrating for the health professional. It's a waste of their time. Nurses are being, caregivers are yelling at nurses, my father's in pain. And the nurse is saying, well, I'm waiting for pharmacy to bring up the medication. As soon as it's here, I'll call down again. All of that anxiety when there's medication sitting on the card already that they could program in and just say, this has been ordered by the doctor now. I have it on my card. I'm going to give it to this patient and bring up now another dose of this for this other patient who gets it in 2 hours. And I mean, it's just human consideration of trying to do what's right for the health professional and the patient. I think it comes from a place of both frustration and empathy, simultaneously. You're not a programmer.
Not at all.
Not at all.
Ask me to write anything outside of BASIC, which I learned in junior high school. The answer would be, I'm sorry, you'll have to find another person to do this.
Right. But you understood that you couldn't run around hospital systems, like you can't make a policy that you can't track in a hospital. But you understood that you needed this, and you're willing to take the chance. I imagine the original funding for the venture came out of the fund of the famous the Wisser family foundation, and you funded this initially to sort of get the pilot up and running. Is that correct?
Yes, we actually raised, I think it's now up to $1.4 million in friend and family money, which included physicians, included friends, included people originally on the management team, and those that just believed in me, and those that believed in the mission. So yes, it was friend and family funded, and continues to be, which is great because our equity round is about to close, which is wonderful. And the people who are closing the first equity round, if all goes well, are also going to be customers that are servicing 30,000 physicians. So it's a nice combination to get a closed contract for revenue generation as well as an equity round investor, so they can benefit on both ends, which makes total business sense.
It's incredible. How did you get to HitLab now? Now, many of our listeners know about HitLab. They've attended the HitLab summits. It used to be twice a year. Now it seems it's every other week that they have some sort of specialized program. It's very impressive, very, very impressive. I think the HitLab team have created a national, international community. It's fascinating for me to see the amount of major companies that are there presenting, major hospital systems that have their chief information officers presenting, or even chief operating officers presenting. It's fascinating to see how many entrepreneurs are there, how many technology companies are there. It's quite impressive what they've done. And of course, it's quite impressive that they realize that you have a special place in the community as a physician entrepreneur. How did you get in touch with them? I mean, what was the catalyst for showing up?
Our second to last chief operating officer turned out to be on HitLab's board of directors, a person that you know, Natalie Principe.
Sure.
And she introduced us, or me, to Stan Kashnowski, and we presented. HitLab utilized their services to vet our technology. They did heuristic analysis. And once they saw and we responded to some of the deficiencies that they identified, and we came out with that phase of our, initial product, they became endorsers. They're not allowed to endorse economically, but they became, academic endorsers of the initiative and academic endorsers of the platform's capabilities. So if you actually go to, if you actually go to our website, www.actualhealthcaresolutions.com, one word, no capitalization, their heuristic evaluation is on the website as an endorser. It then moved from there to assisting in the planning of the summit events. And the reason for my interest in HitLab is very simple. It brings together innovators, investors, academicians, supply chain, life science, pharmaceutical organizations in one environment where they're not trying to sell anything. So unlike some of the other digital health, annual or semi-annual gatherings where it's a sale environment.
Yeah.
This is one to perpetuate and match people together who can then work together to build together in any capacity, right? It's up to the minds and the creativity of those that are around. And the HitLab staff actually work to put people together in that environment to push the ball up the hill, the next to the next level. So it's a comprehensive engagement to the point where we didn't even have to present this time. People were coming to us as our corporation was represented on the exhibit floor. And we're at a point where this fall for the next HitLab Summit will be where our contracted data will be presented. And we are very excited for that particular upcoming event.
Well, first of all, congratulations on that. And I salute you and the HitLab team for recognizing the importance of being, research-based in the analysis and, taking a look at the actual, benefit of the platform in terms of improving the health professionals' ability to care for patients as opposed to, sort of be obsessed with the processes, actually flip to another side of the equation. How do we help people feel better, faster? And that includes also the health professionals, because in my book, Healing the Sick Care System, Why People Matter, I cite a number of leading physicians who have quit medicine, not because they don't love medicine. They love medicine. It's the process of medicine today that they find frustrating. They find they can't really practice medicine as they imagined or once did. Now it's they're administrators. They're slaves to the machines, to the platforms, and you're trying to de-slave. You're trying to sort of like make it simple and make it part of the intuitive relationship flow of conversation. And I've got to salute you for that. So, Jamie,
if I may, Gil,
please.
The 30-second pitch is the platform called the LMREX platform is designed to accelerate speed to definitive care. And that is what it's intended to do. And how it does it is it takes what we normally do as practitioners and as patients, and it digitizes it. It accelerates it by turning the real world into digital models that can be utilized to bypass the human elements where the wasting of time can be actually efficient, but not replaced by more time wasting activities. If that summarizes it, I think
that's a beautiful job. It's hard to believe that we only have minutes left, but I'd love, Jamie, in the few that we have, could you give us a snapshot of what's next? Obviously, the research is coming out and being presented at the full HitLab Summit. I'm eager to see that. I'm eager to write about it. That's one thing. And I'd just like to say, what's the plan ahead? I mean, this is exciting. I don't know if you imagine this being incorporated into someone else's platform or giving it over, or what's the game plan for the venture?
So the question is right on target, Gil, and I'll summarize it in 3 phases, but they're not sequential, they're simultaneous. The first is that our pilot with the largest orthopedic group in Florida And the second or third, depending upon what the ranking list is, radiology group or practice in the United States has gone extremely well. And that's being turned into a revenue generating contract through the radiology organization. We're approaching the other large radiology practices and organizations for similar contracted engagements. That's number one. So it's the commercial side. It's the sales side. The second is we are working with a programming back-end organization that provides EMR services to 30,000 doctors and 2,500 hospitals and practices. And they want us to be incorporated in the back end of their system to upgrade that particular very popular electronic medical record system. We'll hold on the names. The last few moments has to do with a manufacturer of large radiology diagnostic equipment that wants to create, as its new extension for market predominance, a full service suite that can be provided to hospital systems and practices. So these are very important steps that are all taking place simultaneously. Rob Holton, our president and COO, having brought 7 individual companies to sale, has been the leader of this initiative, and I'm happy that he's joined the team.
First of all, congratulations on all this. I had a sense that our conversation would be something big. You have not disappointed one bit. Looking forward to seeing you at other events. I'm looking forward to staying in touch. And congratulations to a world-class, one of the cited best plastic surgeons or surgeons and trauma plastic surgeons in our region, entrepreneur, patient-centric, an ambassador for the physician and health professional community. Dr. Wisser, thank you for joining us today.
Gil, it's been my pleasure. And as always, I look forward to the next time we'll see one another.
Thank you.
Have a good day.
And that, dear listeners, wraps another thought-provoking conversation here on Health Unabashed. A heartfelt thank you to our global audience for joining us and to our guests. Health Unabashed streams live on Healthcare Now Radio Monday through Friday at 10:30 a.m., 6:30 p.m., and 2:30 a.m. Eastern. That's 7:30 a.m., 3:30 p.m., and 11:30 p.m. Pacific. Want to stay connected? Follow Gil at Gil_Bash, and that's BASHE, and me, Greg Masters, MPH, on Twitter, and that's Greg with 2 G's. Tag your insights and feedback using the hashtag HealthUnabashed. Until next time, keep listening, keep learning, and keep raising your voice with no apologies.